Headache is one of the most common neurological problems that we doctors see in our daily practice. Although it being such a common symptom that patients suffer with, there's a lot of misinformation regarding headaches. Hi, my name is Dr. Raveesh Sunkara. I'm a neurosurgeon practicing at Arete Hospitals, Hyderabad. Today I'd like to discuss in detail about a symptom, headache. Headaches are so common that almost everybody in the world would have suffered with one at least once or twice in their life. Although headaches are so common, sometimes they start bothering us when they increase in frequency or they increase in intensity to an unmanageable level that it is disturbing our daily life. So why do we get headaches? You'd be surprised if I tell you that our brain cannot feel any pain. Yes, this is the scientific reason behind performing awake brain surgeries. Then why do we get headaches? Well, although our brain cannot feel pain, the surrounding structures around the brain, that is the meninges or the coverings of the brain, the blood vessels in the brain or the cranial nerves in the brain, these can feel pain and give this pain sensation to the brain. When do these structures around the brain feel pain? So, any activities that leads to a trigger and this trigger causing stretching of these coverings around the brain or the stretching of the vasculature or blood vessel around the brain or stretching of these cranial nerves will lead to a pain sensation. This trigger could be multiple forms. For example, a simple stress that you take in a day or a simple thing that is not suitable to you has been ingested by you. So next we need to talk about what can you do about these headaches. Well, to understand what can you do about these headaches, you have to understand first what is the classification of headaches. There is an International Society on Headaches which has classified headaches into two types, that is primary headaches and secondary headaches. Why this is important is you will understand when you get to know about this. Primary headaches are the type of headaches that have no reason and they occur naturally without any underlying cause. Whereas a secondary headache is a type of headache which comes secondary to a particular underlying cause. For example, having hypertension or having a low blood sugar. Why this is important is that a secondary headache can always be solved by solving the underlying problem. And this is where most of us are mistaken. We end up taking multiple painkillers and taking a lot of treatments for the headaches without identifying this cause of the secondary headache. To enlist some simple causes for secondary headaches, it could be a simple change in the eyesight or a blood pressure increase or decrease as the time progresses. A condition of sinuses being chronically inflamed called sinusitis could be a reason for secondary headache, or hormonal changes in women could be a reason for secondary headaches. There are multiple such reasons for secondary headaches, close to around 140 conditions that have been described to cause secondary headaches. They could be as simple as these reasons I have explained you, or some serious reasons such as a head injury or a brain tumor causing this secondary headache. It is very important for you to identify the secondary headaches and treat the underlying cause. We have to understand that headache or any pain in the body is a sign from our body saying that something right is not happening and this should not be neglected. Coming to primary headaches, usually when all these causes of secondary headaches have been ruled out, we can start thinking that the patient has primary headaches. So primary headaches can be classified simply into two or three types, such as tension headaches, migraine headaches or cluster headaches. Most of these headaches happen without any underlying cause. Some of the patients having these type of primary headaches show a strong family history. That is, either your mother or your sister would be suffering with such similar forms of headaches. The most common type of primary headache that we see in our practice is migraine headaches. Migraine headaches are the type of headaches which are throbbing in nature or pulsating in nature and usually confined to one side of the head. Migraine headaches need to be treated with a particular algorithm in mind. That is, you need to understand how many episodes of headaches of such migraine you are getting per week. This is the first thing that we note. Coming to the treatment of headaches, the first step, like I told you, is identifying whether it is a primary headache or a secondary headache. If it is a secondary headache, then treating the underlying cause becomes our main goal of treatment. Whereas in case of primary headaches, it is little more detailed. First, we need to understand your history. What are the triggers causing this headache? Second, what are the episodes and how many episodes of such headache you are having? Whether it is coming down on over-the-counter painkillers, and how many such painkillers are you requiring per week? This kind of simple history will tell us the exact form of treatment. You need to visit a qualified neurologist or a neurosurgeon to understand the treatment of headaches if these kind of headaches are very persistent and increasing over time. Some simple tips that you can follow at home to prevent these type of headaches are improving your lifestyle. That is, following a regular healthy meals is very important. Second, incorporating some form of exercise, at least 20 to 30 minutes of aerobic exercises like walking or swimming in your daily life for at least 3 to 4 times a week. Then incorporating some form of stress relieving mechanisms such as yoga, meditation also helps you come over these headaches with natural remedies. And finally, having a good sleep is even more important when coming to management of headaches. Aiming to get at least 8 hours of quality sleep every day is of utmost importance. Follow our channel for more such informative videos which are authentic and spoken mainly by the doctors.